developmental phase by 3 months. So the first thing will be neck control, stability of the neck. The exercise for that: roll a blanket or a turkey towel, make it big, make it thick like this, and place the child on the neck, on the abdomen, and allow the child to lift his head and look for the objects. Ask the child, you can show rattles, objects, anything that's visually stimulating or auditorily stimulating for the child, and the child must look up. Shruti, 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 up. If the child is not doing by itself, you can do it by holding the child's head. Be careful, you have to stabilize their neck and show the objects. Do it very slowly. Here the child may cry, but it's not due to pain that the child is crying, so you need not worry about that. It's just a discomfort. But once you start doing this, after 3 or 4 sessions, the child should automatically put up its head and reach and see the objects. The next exercise will be hip raising. This is done to strengthen the muscles of the hip and also reduce the hypertonia of the abdominal muscles. Keep the legs flexed, that is in the V shape like this, both the knees and the hip flexed, and arrest the movements of the leg by placing, don't place your weight on the leg, you just have to harass the movements and stabilize under the knee so that the child doesn't move forward, and arrest the movements of the shoulders and tickle and stimulate the hip, tickle the hip, and the child raises the hip. The child raises the hip and holds it in air. Initially, it may only hold it for a fraction of a second. It's okay. The child will cry. Don't worry about that. It's not due to pain. It's just because you're arresting the movements of the leg, the discomfort. Do this per session 10 times initially. I have to do at least twice a day. All the exercises has to be done twice a day, and per session 10 times. Rolling. Time. And another thing, like these children have a tendency to keep their legs wide apart, so to avoid that, because later on when they start walking they will have their hips widen, so to avoid that, when the child is sleeping initially, tie the legs with a cloth, with a muslin cloth. You can tie even for longer times, even when it's awake. The longer you tie, it's better, but it must be tied surely when the child is sleeping. Tie the legs above the knees. Be careful not to restrict the blood circulation. That's why you use a muslin cloth. It mustn't be very tight, but it must arrest the movements above the knee. Otherwise they will pull it out if it's below the knee. The next exercise will be, we train the child. This is for the developmental phase. We train the child to roll. The leg should be straight. Arrest the movements of the legs above the knee. Hold in the shoulders. And the child must come by itself. You should not pull the child. You just initiate the movement and leave. The child will come on its own. You have to wait for some time. The next exercise will be training the child to roll in both the directions, from right to left and also from left to right. This is for enabling the developmental milestone. This is how you do it. One person hold the shoulders. First initiate the legs. Hold it on the knees. And in the opposite direction as well. First start with the knees, then to the shoulders. Hold the arms straight, otherwise it will not facilitate rolling. So hold the arms and the legs straight.
Even